Health Convo show on Niger Health Radio, your wellness companion. It's a sunny Tuesday. I can see the sunlight shining bright. And I pray your day shines as bright as the sun. As usual, my name is Ogo, and I am here with a woman who is so passionate about public health interventions. She is a medical doctor with wide experience in infectious and non-infectious diseases. She's currently the head, Prevention Care and Quality Improvement Services of Equitable Health Access Initiative. Welcome to the show, Dr. Olatoun Adeola.
Thank you for having me, as usual.
Well, it's a pleasure to have you here. And in addition, she's a mother, a wife, a mother, and a writer. She has written two interesting books. Back to the Health Convo show. On today's topic, we'll be discussing coping after miscarriage. Coping after miscarriage. Now, statistics has shown that for women who know they are pregnant, about 10 to 15 in 100 pregnancies, 10 to 15, that's 10 to 15% end in miscarriage. Now, that brings me to the question, Dr. Adeola. You know, we've been hearing miscarriage. We hear a lot of women tell their stories, about miscarriage. And I begin to wonder, I've never experienced it, but I know a lot of people, a lot of women who have experienced miscarriage, and it's always a bitter experience, and the story does not end well, does not go down well. So please, what is miscarriage?
Okay. Miscarriage is a very sensitive topic, let me say, and it is when a baby is lost before the baby is 20 weeks. A pregnancy that is lost before it is 20 weeks. Just like you mentioned earlier, that 10 to 15% of pregnancies end up in miscarriage. For those who know, now miscarriage is as high as 50%, but many women actually have miscarriage without knowing. You would agree with me that many women are pregnant and they are not even aware that they are pregnant. So as many as 50% of pregnancies end up as a miscarriage without the mother being aware. I mentioned 20 weeks. In medical terms, we call it spontaneous abortion, but it's not abortion in the sense of that abortion. For those who lose their babies at a later period, it's actually called stillbirth. It's stillbirth for those who lose their babies after 20 weeks. We call it stillbirth for them.
Right. Thank you for telling us that about miscarriage. Now, what are the causes of miscarriage? What causes miscarriage? We hear a lot, of things that people say causes miscarriage, but we want to hear from, a professional, a medical doctor. What are the causes of miscarriage?
Most miscarriages are caused by fetal genetic abnormalities. I remember when we were in medical school, our teacher used to say that most miscarriages are marriages, miscarriages and pregnancies that were not meant to happen. They were not meant to happen. Okay, so most miscarriages are caused by fetal genetic abnormalities. That's the number one cause of miscarriage. There are so many other, like we always say, risk factors that could also predispose or could cause miscarriage. That could be infections, especially in the mother. There are some infections, some even sexually transmitted infections that could lead to miscarriage. Medical conditions in the mother, like uncontrolled diabetes, some hormonal conditions, like some thyroid conditions, hypothyroidism specifically, could also cause miscarriage. There's something we call cervical insufficiency, when the cervix is weak and it doesn't have the capacity to keep the baby. The cervix is that part that closes and makes sure the baby stays in the womb. When that muscle is weak, it could also lead to miscarriages. Women who take alcohol, who take street drugs, also exposure to radiation or chemotherapy. These are some of the things that could lead to miscarriage, spontaneous abortions in women.
This came to mind, while we were talking. Is there any age bracket for women who, have miscarriage the most?
Well, it's commoner in older women,
Okay.
and for the obvious reason that older women, especially after 35 years old, are more likely to get pregnant and have babies that have genetic abnormalities.
Okay.
So it may be commoner in older women than in younger women.
Okay. All right. Thank you for that. So, what are the likely psychological effects of miscarriage on the woman? Like I rightly said, the stories are really, sad when such women share their experiences about miscarriages, especially when they've been trying to get pregnant and finally it happened, and the next thing
There's a miscarriage.
So, what are the psychological effects?
Let me say that even for women that have not been trying to get pregnant, even for women that have 2-3 children and they have a miscarriage, there's an effect on them too. So that loss of a baby, it doesn't matter whether it's the 4th pregnancy, the 3rd child, or the unintended pregnancy, the unexpected one. There are psychological effects on most women, and it could be mild, it could be moderate, it could be severe. Of course, this kind of scenario you have described could where a woman has been looking up to God and they've been trying to get pregnant, and then she gets pregnant and she has a miscarriage. The way she may react may be different from the way a teenager, will react losing a baby. So the reactions could be different. But what are the psychological effects? There could be intense grief. There could be depression. There could be what we call post-traumatic stress disorder. We could see it in such women. There could be flashbacks, nightmares, They could also be avoiding situations that will remind them of that pregnancy. For example, seeing a pregnant woman. It could trigger all the emotions and all the memories of having a baby and all that. Once a woman is pregnant, there is an excitement, there is an expectation. You are wondering, is it a boy, is it a girl, when will it come, when will she come, and all of that, and then everything just goes down. So quite a lot of psychological effects. It could also create some fear, and some women could also withdraw from the society, especially because in our environment we discover that most abortions, globally, really, most abortions happen within the first trimester, the first 3 months of pregnancy, which is the period of time during which you are told not to let people know that you are pregnant. So people don't know you are pregnant. Even the people you are working with in the office is not showing so much. Yes. Maybe someone is just saying, you're adding weight, and the rule is don't tell anybody. Even women don't even register for antenatal until after 3 months. So you can imagine a loss that you can't share with people. Yes. People don't even know that you are going through it, and you can't even share it with them. Yeah.
Wow. So now looking at the husband or partner, they are also involved one way or the other, whichever way we want to look at it.
If you see the excitement of a father, that men, when the woman gets pregnant, you know what they say? He said, so we are pregnant.
I know.
The first day, I mean, when I discovered I was pregnant with my first baby, I got into the car. My husband said, so we are pregnant. I'm like,
we.
Oh, okay.
Well, actually, it's we.
It's us. Okay.
Yeah.
So the man is going through the pregnancy with the woman. It's just not carrying the baby. But there's an expectation, there are dreams, that the man is also having, just like the woman. And so yes, the father also goes through some psychological trauma, they could also go through depression. For them, it could even be worse sometimes because they are in between many emotions. Should I be sad? How sad should I be? I need to stay strong for her. One, I'm the man, and then the larger society feels that you didn't carry the pregnancy, so it's not really telling on you that much. And the way the woman is also going through, the woman may feel that you don't know what I'm going through. You understand? The woman may feel that the man doesn't really know what she's going through. So sometimes they need to hide their grief. You find some of them break down when their wives are not with them. Some of them go into the bathroom or wake up late in the night and their wives are sleeping, and then they have a good cry, And I mean, so men also go through a gamut of psychological and mental health challenges when their wives or their partners have a miscarriage. The desire to and the dream of carrying the baby is already, dashed and all that.
All right, we'll be going on a short musical break. When we return, we'll continue on this conversation. Let's take a pause and enjoy this lovely tune by Banky W with Final Say. Enjoy.
What if I tell you, say, me where you see, I don't so see, we're just a jump in it. So be hopeful, cause waiting I know be say, the papa when we serve, know they use us play. We go enter, dancing where you define, we go enter. It might take a little time, we go enter. When the stars align, we go enter. And everything will be just fine. Cause when Oluwa say yeah, 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 nobody can say no. Baba, hello. Cause when Oluwa say yeah, 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 nobody can say no. Baba, hello. Cause you get the final say. No matter what them say, no matter what them do, yes, you get the final say. No matter what them say, no matter what them do, delay is not denial. Keep waiting patiently. You can triumph through your trials if you just believe. So don't give up the fight. Cause Papa God put this sleep. One day you will surely celebrate. He will supply your need. Have a little faith and see that He go enter. He go enter. Dancing where you define. He go enter. It might take a little time. He go enter. When the stars align, we go enter. Everything will be just fine. Cause when Oluwa say yeah, 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 nobody can say no. Baba, hello. Cause when Oluwa say yeah, 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 nobody can say no. Baba, hello. Cause you get the final say. No matter what them say, no matter what them do, yes, you get the final say. No matter what them say, no matter what them do.
Yes, that was Banky W with Final Say. And I love what Banky said. Let me read it out. He said, you can triumph through your trials if you just believe. So don't give up the fight, cause Baba God know they sleep. One day you will surely celebrate. He will supply your need. Have a little faith and see that you go enter.
I think it's a fantastic song
It is
for our
for
topic today.
yes.
In case there is a woman that's just gone through a miscarriage,
Miscarriage.
and you're just feeling overwhelmed,
Yes.
feeling hopeless.
Please don't give up the
You
fight.
go enter.
Don't give up the fight. You go enter, and this time around, you go stay. You go carry your baby.
Yeah.
Welcome back to the show. You're still listening to the Health Convo show on Niger Health Radio, your wellness companion. My name is Ogo, and I am here with Dr. Olatoun Adeola. Before we went on a musical break, we were talking about coping with miscarriage. Dr. Adeola has told us so many things we need to know about miscarriage. She has told us what miscarriage is all about, what causes miscarriage, and the psychological effects miscarriage has on both the woman and the mother and the husband. Now, Dr. Adeola, how can a woman cope with miscarriage? I know.
It's just like coping with any other loss, especially human loss. Yes, the baby is on scene. The woman has not met the baby, but it's also a loss to the mother. It's also a loss to the father and to the family. So the way, we cope with loss generally, number one, she needs to accept that it has happened. For so many women, they may even be in denial, and even for some weeks after the miscarriage, they will still be feeling the symptoms of being pregnant. Some women don't want to accept that it has happened. So that acceptance is very important. And I would also say that she should allow herself to be helped. Okay, so when there are people who know, who want to reach out and help, don't close the door on people who want to help you. Starting with your spouse or your partner, maybe your family members, or anybody that is aware you have gone through what you have gone through. Allow them to help you. Play that role of someone who has lost. I know of someone who had a miscarriage. I was like, it's not a big deal. I'll get through it and all that. After a while, she went into some sudden grief, and she was telling me that you were warning me that I should I should let the grief, even like I said, even for some pregnancies that look like I didn't want this pregnancy, it was too stressful. That particular pregnancy was very stressful for this woman. Yes. And so it was like, thank God I didn't lose my life, but later the grief came and it was really overwhelming. So, and if you need help, please go for help. It's not conventional for women to seek help or to go to a psychologist, to go, for help in situations like this. But if you need help, please go for help and then allow yourself to heal. I discovered that many women after a miscarriage, the next thing on your mind is I'm going to get pregnant again. And it's like
immediately.
Immediately. That pregnancy should happen immediately. Allow yourself to heal, before attempting to get pregnant again. Listen to your doctors. And then learn if there's any lesson to learn from the previous miscarriage. Maybe there was something that could have been done to prevent it. So seek medical help so that if there's something that could have been done to prevent the miscarriage, you ensure that for example, I mentioned cervical insufficiency. There are some things that the doctors can do to help such women. Okay. So if there's something that can be done, seek medical help so that such things will be done to prevent miscarriage in future pregnancy. Get close to your God during that time and let your partner, let them love you as well.
Oh, thank you for that. Now, are there social acts that could further affect a woman's mental health after miscarriage? If yes, what are they?
Yeah, I've had really close people. I've had miscarriages at different stages of pregnancy. And social acts, even from let's even start from the workplace. When women have miscarriages, are they given time off? So do they go on leave? You know, do they go on leave? I mean, who cares? You lost your baby at 19 weeks. Are you going on maternity leave? There was no baby, but you know there are some organizations that actually allow women to take half of maternity leave for such situations.
Okay.
Yes. So such organizations exist. So social acts, I mean, that's flow of kindness even from the workplace, allowing the woman to rest could help. So when the society makes a demand for them to get back immediately, like once a woman doesn't have a baby to show for her pregnancy, it's like she wasn't pregnant
in the first place.
So allowing them to heal is one.
For how long? Now, speaking of the workplace.
Well, I mean, different policies in different workplaces, but let that acknowledgement be. Some organizations may not be able to afford a long period of time for them, but I mean, acknowledge it and allow some rest for them for a while. Also, the way the family also treats them and friends. When you hear things like, you are even very young, so you can get pregnant again. Or thank God you didn't even get to meet the baby. So people even carry their baby before the baby dies. Some social platitudes that we actually offer to people who have miscarriages, they actually make them feel worse than better. And in the process, we are thinking that we are saying something to help the situation. It could actually make the situation worse. So sometimes, and then even the family setting, I know of mother-in-laws who come around to take care of their daughter-in-laws or their daughters or mothers when they have miscarriages. In some settings, once you have a miscarriage, everybody is it's like a blame game, and the blame is on the woman. Everybody is trying to think of what she did wrong. She was going to work. She should have stopped working. She should have stopped, or maybe you should have. And then everybody is trying to think of what you should have done to prevent the miscarriage. Sometimes those things don't help. Sometimes when people are grieving, it's better for us not to say anything and to try to say things that may make things worse for them. So those social acts may also aggravate the grief for the mother and even sometimes the father who are going through such loss.
Wow. Society, you've heard it from Dr. Adeola. Please, let's take it easy on women, who have gone through a miscarriage. So how long does it take to recover from a miscarriage?
How long? It could take as short as 4 months. It could take as long as 3 years. I know someone who had a miscarriage and was trying to get pregnant. Now, this person didn't want to have a baby again. She was done with having children. And then she got pregnant. And she had a miscarriage. And she kept trying for years to have another baby. Because for some women, that emptiness just comes, it's just there. And she just wants to make sure that I get pregnant again. So it could be as long as 3 years for some women. Especially those who maybe it was a precious baby, a pregnancy they had looked forward to having for years, and then it happens and they lose the baby. So there's no time duration really. There are some environmental and societal factors that could shorten the period. Or it could last as long as 3 years.
Wow.
Yeah, it could.
Finally, how can family members support women who had a miscarriage?
Yeah, I had mentioned it. Let's care for them. Let's show them love. The things we do when women just have their baby, go visiting, you cook for them, you help them take care of the house. Let's do it for women after miscarriages. Let's visit them, and not just do like when there is no babies, like, and let's watch what we say to them.
Say to them the words that come out.
Yeah, watch it. If it's not helping, then withdraw. Say less, and then as time goes on, if they want to talk about it, then you can begin to have a conversation and say more and more with them.
Thank
and
you.
Remember to pray for them as well.
Yes, pray for them. Thank you so much, Dr. Adeola. You really taught us so much about all we need to know about miscarriage and how women should cope after a miscarriage. That will be all on the show today. It's been an amazing time as usual with Dr. Olatoun Adeola. Join us next week, Tuesday, same time, same league, and still stay tuned on Nigeria Health Radio for more interesting health content. And as I sign out, I would like to leave you with this word. So be hopeful, cause waiting I know no be say the baba way with the self, you know they users play. That was gotten from Banky W's song.
Yeah, be
Enjoy.
hopeful.
Be hopeful. Yes. Enjoy the rest of your day.
Bye.
Don't be sad.